Hello, welcome to Health Facts on UBCTV. My name is Mary and thanks for watching. Today we are at Unit Skin Clinic here at Acacia Mall, Kamocha, and be talking about dermatology. If you have issues with your skin, or if you've been having this scar on your body and you wanted to get rid of it, then you are right place. We are here at Unit Skin Clinic, and this Dr. Malik will be telling us exactly how we can get rid of this and what cosmetics he can give you to get rid of all this. Thank you for watching UBCTV.
Hello.
Hi.
How are you? Welcome.
I'm Mary.
I'm Dr. Malik Sempereza, Untitled Skin Clinic.
Okay, nice to meet you.
Nice to meet you.
And welcome to the show.
Thank you.
Dr. Malik, tell us who you are and what you do.
Thank you for that question. I'm called Dr. Malik Sempereza. I'm a specialist doctor. I specialize in treatments of skin, and that's what I do basically. I'm a dermatologist. I'm the director and the clinical lead of Unity Skin Clinic. I trained my dermatology from the UK, from Cardiff University, and I did my primary degree in medicine from Cryolipolysis University.
Doctor, tell us, what is dermatology?
Dermatology is a branch of medicine that specializes in treating diseases or disorders of the skin, hair, nails, and genitals. That's what we call dermatology.
Doctor, tell us, why would someone choose to do cosmetic dermatology?
Cosmetic dermatology is basically it's what I would call a new field, relatively new field in Uganda. And most patients who ask about cosmetic dermatology are people who have maybe traveled, people who have been exposed a bit about it, what it's all about. And other patients that we see, clients, they usually come in with problems, and we tell them actually the solution to that problem is cosmetic dermatology. Cosmetic dermatology basically involves plastic surgery, which we call plastic surgery. This is a branch of dermatology whereby we do things to patients, treatments or procedures for cosmetic reasons. That means improving on their appearance, on what they look like. So that's what we call cosmetic dermatology. So people would come to us for several reasons. The most important reason, the biggest factor why so many patients come in is to look good. When someone looks good, they feel good. Some people that touch that, that they need to look good to feel good. When someone wakes up every day, they look at themselves in a mirror, and if they don't like what they see, then they won't feel good the whole day, So most people come in because of self-esteem, because your image, your face, most people, the way they say it's your ID, it's your passport. So that gives people the confidence to move on in their day-to-day lives. So most patients come in. There are different groups of patients within cosmetic dermatology, all right? The first group is the young mothers who've given birth, and they have that excess fat around the belly that they want to get rid of. So that's what we call, that comes into cosmetic dermatology. They have that excess fat. How much they try to work out, it's still there because of the Caesar they had, the C-section scars. Then the other group of people that we see, people had traumatic events, they have scars, plenty of scars. Some people come in when they have scars as a result of acne on the face. Some people have accidents or burns and they have scars and they need to be treated. So that all falls in cosmetic dermatology because we do improve on scars. So we provide scar treatment. Then we have the other group of anti-aging. We have people who have made their money, they've relaxed, they've retired, but they want to look good, they want to feel young. So they usually come in, if they want to have wrinkles removed or reduced, or eye bags. If they have eye bags, as you age, you have those eye bags that come around the eyes. So we get those patients who come and we have that done as well. Yeah. Those are some of the major reasons why people would come for cosmetic dermatology.
Even if wrinkles haven't shown up yet, you need to stop tanning now because they will. Once signs of aging appear, you'll be spending a lot of money to reverse it. So if you have sun damage, you can reverse the damage with photorejuvenation, such as pulsed light treatment. Many spas and dermatologists provide these pricey fixes. If you do have brown spots, treat them with lemon juice diluted with water.
What are some of the considerations for someone to choose to do cosmetic dermatology surgery?
First of all, age. Age is very important. Wouldn't want to work on someone who is too young or too old. Then whenever you're going to do for any plastic surgery or cosmetic surgery, safety comes first more than anything. So we have to weigh the benefits versus the risks for each individual. So we assess each individual as they come in. So we see what benefits are we looking for. For example, if you want to lose weight, if you're obese and you want the liposuction to remove that excess fat, that would be the benefit. But what would be the risks? If you're too fat, we need to see. If you're too obese, we need to see, are you fit for the general anesthesia? Because when you put you in theater under the table, will you be fit? Will you come out much better? So we weigh the benefits and the risks. Okay. So what you consider: the age, how healthy you are, patients who have chronic diseases like diabetes, someone has asthma, someone has hypertension, all those chronic diseases, we usually don't consider such patients because, like as we say, this is cosmetic dermatology surgery. And patients who have had alcohol, definitely alcohol, you are not a fit candidate for having a surgery. We need you to have clear lungs. So if someone is a chronic smoker and they have chronic disease of the lungs, definitely we don't consider that. Basically, you must be healthy through and through. Safety always comes first. So always make sure that the benefits outweigh the risks of having the surgery.
It is important to cleanse your face every night, not only to avoid clogged pores, but also to wash away all the dust or pollution your skin has been prone to during the day. For anti-aging regimens, you need to keep it up for the best effects. You may suffer redness and a bit of peeling at first, but this is normal. To get the full effect of acid peels, retinoid, and moisturizers, you have to keep at it. The initial benefits will go away if you stop using them.
Doctor, we've had several types of skin diseases. Could you please explain to us these diseases?
There are so many skin diseases. Dermatology is a very wide field. So maybe I can talk about the most common diseases that we get to see in the clinic here. The most common diseases that we see are acne, that affects so many people, so many women, so many young women and young people generally. Sometimes it comes in the elder population. So acne is one of the most common we see. Then we see a lot of eczema, which is picking up in the young generation. So we see so many children who have eczema and dry skin rashes. And then because of the prevalence of HIV in Uganda, every patient who has HIV must have at least 2 skin diseases. So we get to see a number of skin diseases that are attached to HIV. And then we get to see patients who have hair loss problems. That's also another factor that we get, all right? And then we get patients who have, there's so many diseases, like we get patients who have skin cancers, some types of skin cancers, especially the white population in Uganda. Because of the sun, they tend to have that as well. And then we get to have the infections. The infections, we have fungal infections of the skin. Those are very common. We see them a lot here as well. And bacterial infections in children mainly, we see that as well. And then we have the allergies, the skin allergies. That's also a big thing that we see a lot more. So those are major categories of disease that we see in the clinic.
We've had incidences of people dying after these surgeries, more so cosmetic surgeries. For example, the recent one of John Rivers, who died So how can you convince me that after doing this cosmetic surgery, I'll come out when I'm alive?
That's a very good question. It's one of the biggest worries of most patients here, especially in Uganda. Actually, most patients are not yet used to. There's a low pickup of cosmetic surgery in Uganda, mainly because most patients have that fear. You know, when a patient comes in, you explain to them that, you know, these are the risks, these are the benefits. Once you mention the word surgery, general anesthesia for the major surgeries like the tummy tuck, liposuction, breast enlargement or breast augmentation, if they are doing facelifts, you know. So such surgeries that need general anesthesia, patients would love to have the surgeries, but once you mention the risks that is general anesthesia, they freak out and, you know, they think twice about it. So it's a very good question. Now, like every surgery carries a risk, okay? The most common risk that we talk of when having a surgery, one, the general anesthesia, all right? The fact that you're putting someone under, giving them medication, put them to sleep, relaxing the body, that is a risk in itself. Two, there's bleeding, of course, a lot of bleeding that can happen. Three, infections after the surgery. Now, it's very good I talked about John Rivers. The first thing I talked about is safety always comes first. With cosmetic dermatology, the benefits have to outweigh the risks. John Rivers was old, all right? So that put her in the high-risk category of doing the surgery. So definitely here, I wouldn't do that surgery because she would be a high risk, so I wouldn't do such a surgery. So would assess you, you know, if you're healthy and you're fit, you'd come out really well, you don't have any issues. Two, the surgeons that we have who do these surgeries are professional, they are qualified, they have years of experience performing these surgeries. So the risks are always very minimal. We try to make sure they are as minimal as possible. If there's any risk to a patient, we just don't do the surgery.
While it's a myth that wrinkles are caused by dry skin, moisturizing can improve the appearance of lines by temporarily plumping them up. Also consider a good eye cream. The neck and chest are first to show the signs of aging because they have fewer oil glands than the rest of the body, yet most of us ignore them. Look for moisturizers that have age-fighting ingredients like vitamin A, retinoids, quinatin, copper, or vitamin C. Never pull and rub your skin. Aging skin has been under attack by ultraviolet rays, stress, and carbon monoxide, so don't stress it more by pulling it.
Doctor, tell us some of the cosmetic procedures that one can use other than the surgeries.
Thank you for that question. And it's a very good question because what we brought in, there's a new branch in cosmetic dermatology, you know, that's called aesthetics medicine. This is a branch that is giving alternatives to patients that are alternatives to surgery, basically the cosmetic surgery. So we have quite a number of procedures that we can perform, treatments that we can give that would still give you a result, you know, a good result, but definitely it won't be as fast as the surgery, because with the surgery you're in, you're out after a few days of healing, you know, that's it. But these procedures are quite effective and patients actually are really comfortable with them. You know, you tell them, you know, we will get a result in 3 months or 6 months, and actually that is something which is picking up. With the aging, I'll begin with aging. Patients who are worried about aging, we have procedures that we perform that are surgery-free that would help to rejuvenate the face. So what we call facial rejuvenation procedures. One, there's something called laser. We use what we call fractional laser. We pass the laser beam on the face. It rejuvenates the face. It removes wrinkles, so you don't have the worries of the surgery. Two, we have what we call the derma roller. It's a nice instrument that has so many needles that we roll on the face. That helps to remove scars, uneven tones, so that also is an alternative. We have what we call a microdermabrasion. It's a machine we use to pass on the skin as well, which helps to polish the skin. And then people who have scars, there are creams available. What we do usually, we combine the treatments, most especially the derma roller. We use the derma roller, with the creams that help to treat the scars. So the medicine is infused and it helps to remodel a scar. So those are some of the major alternatives we have. Weight loss, there's one that is very new technology that we have. It's called Cryolipolysis. Basically, it's a machine for people who want to lose that excess fat. We put it on. It has pads that you put on. So these pads, they have electricity and electromagnetic energy that targets only the fat cells under the skin. So the skin remains intact. You just come in the clinic for a session that lasts 1 hour. We put the machine on you. It dissolves the fat cells, and they pass out in your kidneys, in your urine naturally. So you lose weight gradually, but it's an alternative to the surgery, and it's also really good. So those are some of those alternatives we have to cosmetic surgery.
Tips to get your skin glowing. Get your shimmer on. Use a product with fine particles of mica to show off your inner glow. We are not talking sparkles, but sophisticated shimmer. Apply a touch of illuminating moisturizer or powder on your shoulders, chest, and neck. Use mineral makeup. Mineral makeup can give you the coverage of a liquid or cream foundation, but it is much healthier for your skin.
Doctor, what advice do you give to these regular Ugandans about cosmetic surgeries?
Cosmetic surgery is basically a new field, relatively very new field. We have very few plastic surgeons, cosmetic surgeons in Uganda. The advice I give to you, it's very safe, okay? The people who are doing it are professionals. The places they do it from are really good. It's going to be a matter of time that, it's going to pick up, that people will be like, oh yeah, actually, she also had that done. I can also have it done. There's nothing wrong with trying to make yourself look good, because that's your self-esteem. So you don't need to shy away from it. If you want to do it, there's absolutely no problem with doing it. And there's a lot of support for you, and it's something you can do. It's relatively safe. If you don't go for that option, we have alternatives. So it's really good, and it can be done.
Thank you so much, Doctor, for your time, and it's been amazing having you on the show. Okay. Have a good evening.
3 things to pack in your bag. Bloating tissue. When your face starts to look oily, you'll be so glad you brought bloating tissue. Simply blot your skin with bloating tissue and toss it in the garbage. It will soak up all the oil and your skin won't look shiny in pictures. Pack extra, your friends will be borrowing. A compact. After you use the bloating tissue, put on a bit of powder to keep your skin looking finished. Lip balm. Lipstick can leave your lips dry. Lip balm will leave them looking shiny and smooth.
Again, thanks for watching UBCTV. My name is Mary, and if you want to look good, and if you're aging and you still want to look young again, then you're watching a right place. You can always come here to Unit Skin Clinic here at Kamocha, and they do everything for you. That's all I had for you today. Until next time, good night.